Okay, so my name is Wade Raskelly. I'm doing this presentation for a communications class, and the topic I've chosen is hands-only CPR, which is a new approach that the British government has actually gone to, the British Heart Association has gone to make bystander CPR more effective and to kind of take all the thinking out of doing CPR. So for myself, I am a registered nurse. I have 15 years as an EMT and as a registered nurse, obviously. And I've performed CPR and done over 20 codes in my lifetime, which really isn't a lot if you were considered like comparing me to like an ER nurse or an ER doctor. But I think it's some experience, and so I think I'm fairly qualified to speak on this subject. The Center for Disease Control says every year about 735,000 Americans have a heart attack. Of these, 525,000 are first heart attack, and 210,000 happen on people who have already had a heart attack in their lives. So, like, chances are in your lifetime, if you come upon someone that you have to do CPR, chances are it's someone that you're going to know. In fact, heart.org gave some statistics. 41% of all cardiac arrest CPR was done by bystanders in the year 2013, and the numbers were very similar for 2012, whereas only 23% of cardiac arrests happen in the hospital where nurses and doctors. So, like I said, these are things that, like, chances are good that you're going to have to do CPR on someone, whether it's going to be your mother, your sister, your brother, your grandfather. Like, this is something that all of us need to learn. So, just to review, what are some of the signs of a heart attack? Number one, they're kind of classic, if you remember, the substernal chest pain. Now, a lot of times you'll have someone who exercises and they do a bunch of push-ups and they're having chest pain, but if you push on their chest, obviously that's going to make it worse. Substernal is kind of like that crushing underneath, feels like someone's sitting on your chest. Some of the other classic signs are pain that starts here and it will radiate to the left arm, and that's really common. Some of the less common ones are pain in the jaw, which is more common with diabetics and women, actually. And then obviously if you're having chest pain and you try to walk somewhere and that chest pain gets worse, then that's obviously something that should be checked out by a doctor, or even call 911 at that point. Difficulty catching your breath, blue lips, and then nausea and lightheadedness along with that chest pain. Now, so what I wanted to do, I wanted to talk about heart rhythms, and hopefully you can see this. So what I have here is I have an example of what is called a normal sinus rhythm, okay? That's this top rhythm, okay? And what you have is you have what's called a PQRST rhythm, okay? So this first wave, bump, is called the P wave, QRS and T, okay? So with the P wave, what's happening is the atria is contracting, okay? And that's telling the ventricles that they're going to contract also. So you got the P wave here, and that's the atrium contracting. You have this big jump, which is the ventricles contracting, and then the T, this last bump, is that's when the ventricles are kind of relaxing and going back, getting ready to pump again. Okay, this is normal. You see this on all the TV shows. That's really normal. Okay. Well, when you're in cardiac arrest, what happens is your heart gets confused, or it will get stuck. And what happens is, instead of doing this like nice pauses in between at a nice rate, what happens is it starts kind of just to quiver, okay? And it looks like you would think, like, because this is a contraction, that this is really contracting well, but what happens is it's quivering so hard that it can't catch its breath, and so this is really ineffective, and so no blood is being pumped throughout the body, even though it's moving really, really fast, and it looks like those waves are going really big. And then the last one, and you've all seen this when someone dies on TV, you have this straight line, and we know that's when someone's dying, okay? So this rhythm is what we're going to be talking about. Now, obviously, if a person has this rhythm, we're not going to be doing CPR because they'll be breathing and talking to us. If they have this rhythm, they'll be passed out and they won't have a pulse and they won't be breathing most likely. And if this rhythm is there, that's a 911 do CPR until the doctors can declare them dead. So what happens is when we have this rhythm, okay, the way that we get this back to normal rhythm is by a defibrillator. Okay, if you work in an office building, a lot of times you can be walking down the hall and you'll see one of these in kind of a case on the wall, and these are really simple to operate. And I don't have one to show you how to run, but they're really simple. All you'll do is you'll look at the pads. You put a pad here, You'll turn the defibrillator on, and if the defibrillator recognizes this pattern, it will advise you to shock, okay? And so what will happen is you'll push the shock button, and the shock button will deliver a shock, okay? Now, what that does is, and here's a picture of a defibrillator on somebody, what that does is you see this really unorganized rhythm where nothing's happening. What that does is it shocks the heart, right? So it shocks it, and it's kind of like slapping somebody, where the heart kind of stops for a second, and it goes flatline for just a little bit. But what that does is it allows the heart to go back to normal operations. If you have someone that is in cardiac arrest, okay, the only way that this rhythm goes back to this rhythm is if you have a shock, okay? So the purpose of CPR is not to start someone's heart up again. The purpose of CPR is to buy time, okay? It's to buy time to where paramedics or someone with a defibrillator here can come and deliver a shock to the heart so that heart can restart back up, okay? So let's talk about hands-only CPR. This is, like I said, this is a new approach to CPR. Used to be they had like 20 steps. You had like, you got down, you did the head tilt chin lift, you listened for 2 minutes, you felt, you watched for breathing, and they've kind of gone away from that. What they're doing is that when you come upon someone and they look like they're not breathing, you're going to look at the patient and you're going to look for signs of life. And signs of life are hands moving, obviously chest rise and fall. And even though I've done hands-only CPR, I still do the head tilt chin lift because I like this as like a time to think, kind of assess, to look, listen, feel, and it's still appropriate, okay? So what we're going to do is we're going to look for signs of life, okay? This is our patient, and obviously, well, it's not much of a patient, okay? What you're going to do is you're just going to go, you're going to put your hands together like this, okay? Arms straight out like this, and you're just going to look for the nipples. I don't know if you can see that very good on the camera. We have the ribs that come up here, and you're going to put your hands directly in the middle on the sternum, and you're going to depress 2 to 2.5 inches, and you're going to go 30 times, and you're just going to go, and you're rocking your body rather than, if you do this, you're going to get tired really, really fast, okay? What you're going to do is you're just going to rock, and they're recommending 100 beats per minute. Now, it's really easy to assign this to a song, okay? And there's a song from the Bee Gees called Stayin' Alive, and it goes to the beat of 100 beats a minute, okay? So, if you were to come upon this patient, and I'm going to play this song, okay? Oh. Technical difficulties, I apologize. Seriously. Alright, there we go. Hopefully that works for the rest of the time, okay? And so what you're going to do is you're looking for signs of life, and then so you're calling 911 first. You're looking for signs of life, and then you're going to start doing CPR. You're depressing 2 to 2.5 inches deep, hard and fast, while 911 is on the way. And once 911 gets here, what they're going to do is they're going to attach the defibrillator to each side, and they're going to deliver a shock that will hopefully stun the heart and bring it back into our normal sinus rhythm, okay? So, recently I was at work, and I had a patient, and he had just come back from the hospital, and I went into his room and I said, "How were you doing?" And he's like, "I feel great. Please let me go back to my house." And I was like, "Look, let me have the doctor come and see you. I understand you feel great, but I want to check you out." I did his vital signs. He looked fantastic, so I went and talked to the doctor, okay? And I talked to the doctor, and the doctor's like, "Yeah, if he feels great, let him go back. He was doing great." So I went back into the room. I work in a prison, and I was there with the prison guard, and I walked in the room, and he did not look the same, okay? He was slumped against the wall, his head was tilted forward, and he looked blue, okay? So obviously, like, I looked for signs of life. I knew, like, his lips were blue, and he was bubbling out of his mouth. And so what I did is I pulled him off the wall, and I did a head tilt chin lift, and I listened, okay? And I said to the officer, I'm like, "Officer, I need help. I need you to go have the other nurse call 911, and I need people to come and help me do CPR." So what happened is he went and to get people, and it took a while, right? And I started to have a little bit of anxiety, because even though I've done this before, it's still really difficult to do. So what I did is I lifted up his shirt, because I didn't have anything to cut the shirt off. I lifted up the shirt, and I just started, and I started singing in my mind. It's really easy to do. Like, it's really easy, because literally there's one step. You're calling 911, and what you're doing is you're just doing compressions to stay alive. So the point of this presentation is to make you feel comfortable to doing hands-only CPR. A lot of people, they get freaked out by doing mouth-to-mouth. This is movement away from that. You're still getting chest rise and fall and compression of the lungs, and so you're still getting air in and out, but these compressions are what's most important, okay? So in conclusion, what I'm looking for is to have you feel brave and step up to the plate, so when this happens, that you'll feel confident enough to do CPR when your family members or someone on the streets falls over and needs CPR to be done. Thank you.